An open wound is any break in the skin, from a pin puncture to an amputation, and it may be only the surface evidence of a more complex and serious injury. The first aid treatment for an open wound is to stop the bleeding and to prevent infection. Repair of the wound should be left to a doctor. In first aid, open wounds are divided into 5 classifications.
Abrasions, removal of a portion of the skin caused by rubbing or scraping. Avulsions, a tearing away forcibly of the skin, tissue, or parts of the body, such as the fingers, toes, or an arm or leg. Incisions, smoothly cut wounds without bruising or tearing, produced by a sharp cutting edge such as a knife, glass, metal, or sharp edge of coal or rock. Lacerations, wounds with ragged edges that have been torn or mashed by blunt objects, machinery, or rough surfaces. And punctures, wounds that have been produced by pointed instruments such as needles, nails, splinters, or pieces of wire. To prevent infection when treating a wound, use a sterile gauze. Wipe any loose foreign particles from the wound. Wipe away from the wound, not toward it. Do not touch the wound with your hand or anything that is not sterile. Do not try to cleanse the wound with water or drugs. Do not attempt to remove a foreign object embedded in the wound. Leave all this for the doctor. In case of severe bleeding where direct pressure is not controlling the bleeding, digital pressure must be used. After bleeding has been controlled, place a sterile bandage compress or gauze over the wound and tie it snugly in place. The knot should be tied directly over the wound unless this would further aggravate the injury. Bandage wounds snugly, but never tightly. A bandage that is too tight may interfere with the blood supply to surrounding tissue. Make all sterile dressings wider than the wound. These dressings should then be protected by an outer dressing or cover bandage made from a cravat or triangular bandage. Center the cravat over the gauze compress. Cross the ends over and tie the knot directly over the wound. To treat an abrasion, apply a sterile bandage compress over the area of the wound, pass the ends several times around the hand and wrist, and tie them over the pad in the palm. Place the center of a cravat bandage over the pad, bring one end around the little finger side, the other end between the thumb and forefinger, cross the ends well back on the palm, and bring them around the wrist. Tie the ends at the back of the wrist. To treat an avulsion, control the hemorrhage. Apply a sterile bandage to the wound. In this case, hold the tails of the bandage securely at the base of the finger. Make one circular turn with one of the tails above that point to anchor the bandage. Make a circular turn around the base of the finger. Carry the tail by spiral turns to the starting point. Omitting the first circular turning, apply the other tail in a similar manner with spiral turns in the opposite direction. Tie the ends on the back of the finger. Cover the wound with a cravat bandage. Body parts taken off may be successfully rejoined by a surgeon. Pack them in ice for transporting to the medical facility. To treat an incision, apply the pad of a sterile bandage compress or sterile gauze over the wound. In this case, Pass the ends of this bandage diagonally around the body. Cover with a cravat bandage. Do this by centering the cravat bandage on the side nearest the injury, taking the ends across the back and abdomen or chest, and then tying. A laceration is the fourth type of wound. To treat such a wound, apply the pad of a sterile bandage compress over it, carry one end down the side of the face and under the chin, and the other end over the top of the head. Cross the ends at the opposite temple in front of the ear. Carry the ends around the front and back of the head and tie them over or near the compress pad. The compress is then covered by a cravat bandage applied in the same manner. The fifth type of open wound to be treated is a puncture wound. Apply the pad of a sterile bandage compress to the wound, carry the ends around the foot and ankle, and tie over the compress pad. Using a cravat bandage for cover, center it over the compress and carry the ends around the foot and ankle, ending in a tie as near the front of the ankle as possible. If there is arterial bleeding, it should be controlled by digital pressure over the nearest pressure point. When bleeding is severe or uncontrollable, a tourniquet can be used. It should be applied over the nearest applicable pressure point above the injury and should not be loosened except by or on the advice of a doctor. Although there are different kinds of open wounds and different degrees of seriousness, the important thing to remember is that the greatest dangers with all open wounds are loss of blood and infection. Therefore, the aim of first aid treatment is to stop the bleeding and apply protective dressings or bandages to help control the bleeding and to screen out bacteria which may cause infection. Closed wounds, such as bruises, strains, sprains, ruptures, or hernias, are injuries that occur without breaking the skin. The damage occurs to underlying tissue. Bruises are treated by elevating the affected part and by applying ice bags or cold towels. This will help to limit swelling and decrease pain. Strains occur when muscles or tendons have been overworked or stretched. Treatment is to increase circulation in the area by applying hot applications to reduce the pain. Sprains are injuries that result when muscles, ligaments, and other tissue around a joint are stretched and torn. For treatment of a sprain, use cold applications, such as compresses wrung out in cold water or ice packs to relieve the pain. Ruptures or hernias are injuries that result from a combination of weakness of the tissues of the abdomen wall and muscular strains. The patient is treated by bandaging him while he is lying on his back with his knees well drawn up. If the patient must be moved, keep him in this position. As in the treatment of all open wounds, persons suffering from closed wounds should receive medical attention as soon as possible.